Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. As schools and childcare facilities in Massachusetts are preparing to reopen, many parents are left wondering how they can continue keeping their kids safe and healthy during the ongoing pandemic. Tonight, I'm joined by Dr. Jeremy Warhaftig, a pediatric specialist at South Shore Health. He is here today to talk with us about monitoring your child's health, tips for starting conversations about healthy habits, and all of the ways that your pediatrician can help keep your kids both safe indoors and outdoors this school season. Welcome, Dr. Warhaftig. We're so happy to have you join us tonight.
Hi, thank you for having me.
Awesome. Thank you. Well, this is the big topic, the new normal this year. School starts for many schools here in Massachusetts next week, I believe the 17th, the 14th. And COVID-19 is still a concern for parents of school-age kids. What should they know going into the new school year?
Sure. Well, I think one of the things they should keep in mind is that the schools have really worked really hard to make things as safe as possible. They've worked hard in terms of cleanliness and cleaning protocols. They've obtained huge amounts of cleaning supplies, hand sanitizer. They've really worked really hard following the guidance from the state and the federal authorities, trying to make the schools as safe as they possibly can be. Been really impressed with what the schools have done in terms of trying to make the environment as safe as it possibly can be.
So, in light of all that, how can children head back to school safely in light of this pandemic?
Sure. Well, kids, first of all, like it goes without saying, kids when they go back to school need to wear masks. They need to make sure if they're sick, they don't go. That's really up to their parents. Number one, if their kids are sick, they shouldn't send them. And then they should practice what they need to do before they go to school. So if they're not used to wearing masks, they should spend a lot of time at home wearing a mask. They can do it playing games, or if they do any video games, or while they're watching TV or reading their books. They should get used to wearing their mask. So it's something when they go back to school, it's not something that is different or novel for them. So that's really important. Um, they should make sure that they've gotten all their vaccinations, that they're up to date with everything that they need, and they should be making sure they're rested, they've been well fed, they've been getting plenty of exercise prior to going back to school, so that they're in as good a shape as they can be.
Gotcha. So it sounds to me like there's a lot of role playing going on here, right? So
Mhm.
parents should be having conversations with kids and talking to them about what to expect. If as a parent, what would you say to a child who may be apprehensive about going to school or is uncomfortable about wearing a mask?
Sure. I think one of the things to point out is that they're not going to be the only ones who are doing it. That's going to be the thing that all their friends and peers are going to be asked to do. So that they're not going to be singled out in any way.
Mhm.
Uh, and I think it's just to remember them that students need to be told and reminded by their parents that everybody is doing what they can to keep them safe, and that their parents aren't going to send them into an environment that isn't safe for them.
Mhm. Gotcha. There are probably some things that parents should be sending their kids to school with this year. I mean, I do understand that backpacks will be allowed in schools, but there's going to be probably less school supplies in it and a lot of back and forth. They don't want a lot of exchange back and forth. But what are the key things that parents should be sending their kids to school with besides a mask?
Sure. They probably should always send more than one mask. First of all, a couple just in case it gets soiled or wet or not. Although the schools will have plenty of extras just in case. They might want to think about sending their kids with some wipes just to wipe down their desk before they start class. Um, Bottle of water so that they stay hydrated. During their chances, all these kids when they go to school, even though they're going to be expected to wear masks all day, they're going to have time to go outside and get mask breaks. So they should bring some water with them so that they can stay hydrated. Those are the main things, I think. And then, of course, most of the schools, if they're older kids where they have to bring their own devices, they'll have to bring their computers, things like that.
Gotcha. And now, adjusting to all of this new normal, how can parents keep kids safe not only in school but outside of school when they come
Sure.
home?
Well, I think one of the things to keep in mind is that the standards that they're using at school, they need to do the same things when they're out of school. So they really need to be consistent about wearing their mask properly. That's really important. If the mask isn't covering their nose or isn't fully covering their mouth or hanging down off their chin, it's not doing them any good. They need to keep their social distance. So that's something when if they have to go someplace with their parents in public, they need to be careful about social distancing. Um, That's probably, those, so doing the same type of habits that they're going to be doing in school, the social distancing, the masking, the frequent hand washing, ideally with soap and water, but if not with soap and water, then with hand sanitizer, making sure they're learning how to wash their hands properly. The happy birthday song twice is the kind of typical way to do it if you're using soap and water, but making sure you use hand sanitizer, using enough of it. So things like that, and just making sure what you're doing at school, you're doing it at home and when you're out and about.
We have our first question for the night. There's been a lot of protests in several districts with teachers about going back to school. Can you talk a little bit about the implications of COVID-19 for meetings of adults and children inside school? So, what's the risk level regarding that?
Yeah. So, unfortunately, the risk isn't zero. That would be, there's no such thing as zero risk. I think the risk is pretty low if people can follow the right guidelines in terms of masks and distancing. So I think that's the key. So if you have too many people in a small space, then that's a problem. But I think all the schools are working really hard to make sure that they're not having too many people in their schools, that they're keeping. That's why that the most common model I'm seeing is a hybrid model where often at least half the students, if not more, are at home at any one time. So I think if you keep the numbers down and you keep the space correct, and you're able to have appropriate ventilation, which I think the schools are doing a really good job at doing, the risk is low. But it would be to say that the risk is zero, that's not really fair either.
Gotcha. We've also had some commenters who are questioning the effectiveness of some of the precautions that we've already talked about today. What evidence is out there right now about the efficiency of masks? And actually, how well does a mask help protect people? What should parents know about that?
Sure. So I think that we know a lot. The evidence is varied, but it seems to be pretty good that masks are pretty effective about keeping folks safe. The key thing about masks is that the numbers work much better if everybody's wearing it. So if I'm wearing a mask and you're wearing a mask, we're protecting each other very, very well. So if I'm wearing a mask, you're not wearing a mask, then you're protected somewhat, but I'm not protected nearly as much. So, I think the key thing is that everybody has to be wearing a mask properly, and it has to be the right kind of mask. So it doesn't have to be like one of these fancy N95 masks that healthcare providers wear, but it should be more than just one of the buffs. It should be something that fits reasonably tightly against the face, with ear loops. Again, it doesn't have to be a healthcare mask. It can be a fabric mask, but it should be several layers. I think the most recent thing I've seen is that 3 layers is appropriate. But and also, of course, it has to be comfortable. So if the mask is super itchy, and then the child has to keep playing with it or pulling it down, then that's not doing anybody any good.
So speaking of masks, it's probably a good idea, like you mentioned earlier, that parents should have several masks on hand, right? You don't want to just have one. How often should parents be cleaning those masks? Excuse me. Are you looking at, every day when a child comes home that mask should be cleaned, or how often should we do that?
Yeah, so I think ideally fabric masks should probably be cleaned every day. And I think that probably the best way to handle it is to have several masks in your rotation so that you don't have to wash stuff every day, but you're able to do, for example, a couple times a week you're washing them. So I think you have to also factor what the child's doing. So if a child is, for example, like for a lot of the sports that are out there, kids are wearing masks, are being asked to wear masks. I know my son's a soccer player, and he has to. All the soccer leagues are making them wear masks the entire game. So that mask, if it's a fabric mask, is obviously going to get it washed right away because it's going to be sweaty and gross. But I think washing it every day or every other day, but probably having a few in your repertoire and your regimen so that you can rotate them is probably a smart thing to do.
And let's be honest, there's so many cool styles and fabrics.
Sure. I think
make it fun.
If kids can be involved in picking ones out that they like, that's going to increase their chance that they're gonna wear it.
Very cool. We have a question from Allison. She said she's not willing to risk her child's health and life. And some other commenters have also suggested that going back to school is more important. So what's the balance here? How should parents strike a balance in their decision about this fall?
Yeah, that's an excellent question, and it's really, really hard. It's not there's no right answer to that. I really think you have to look at your child's health and the health of the immediate family, and thinking about, are there any people who are at extra risk from COVID? one thing we have to keep in mind with kids and COVID is thankfully the severity of illness in general is much lower in kids than it is in adults. That's not to say that there are a small number of kids who do get seriously sick. That is the case, but it's many fewer kids than adults are getting seriously ill. You have to factor in other things such as the risk of them not being in school. And the schools are working hard to make virtual learning as good as it can be, but it's not the same as being there. So it's really balancing things like everything else in life that we balance, and you have to, as a parent, decide what your risk tolerance is. And there's not a right answer. You have to decide for yourself what you think is best for your child and your family.
Mhm. And along that same lines, how important is it that parents set the tone for the school year coming up? So, in other words, if mom and dad are maintaining a positive attitude about, this is going to be different and it's going to be new, but we're going to go in this and be as positive as we can. How important is setting that tone for kids as opposed to, oh, this is going to be the worst experience ever? You know what I mean?
Yeah, I think setting a positive tone, like for anything you do in life, looking at things in a positive light is important. You can always push things in a positive direction by looking at it positively. And conversely, if you go into it with a negative point of view and a negative attitude, your kids are gonna reflect on that, and they're not gonna get as much out of it as they can. We know that this is, the circumstances are crazy and the world we're in is crazy, but I think there's still lots of opportunities to make this positive and make the school year positive for our kids.
I want to encourage everyone at home to send in their questions. I'm joined this evening by Dr. Jeremy Warhaftig, a pediatric specialist at South Shore Health. Dr. Warhaftig is doing his best tonight to answer your questions about going back to school in this new normal and how parents can maneuver around this pandemic and keeping your kids safe, healthy, indoors and outdoors. Dr. Warhaftig, I have a question for you. Flu season is coming upon us. How is a parent supposed to figure out, hey, my son or daughter may just have a cold today. It's okay to send them to school. Or, geez, this might be a little more than that. Flu, COVID. What should a parent do?
So this is something that's really different this year. Basically, if your child has any symptoms, even if it's just a runny nose, they really shouldn't be going to school. That's in terms of then sorting out. I think it's things like a runny nose by itself is tricky because that could hypothetically be COVID, or it could just be cold or allergies. But the baseline thing in that situation is initially keep them home. If they have a runny nose for a day and then they're better, I think the current state guidelines would say that they can go back to school once they're doing better. But that's the first thing, is that, in the old days or previous years, they have a little tiny runny nose and say, all right, I'm just going to send them to school. That's not the way things should go this year.
Okay. Should they call their PCP if they have any bigger concerns than that?
They should call their PCP, or if their PCP does electronic messaging, they should be in contact with their PCP's office to get additional guidance, whether that means they come into the office or they get a COVID test, or they just stay home initially and monitor symptoms to see what if anything else develops, but be in contact with the PCP office makes sense.
All right, terrific. We have a question from Henry. He says that he thought younger children are supposed to get sick a few times a year to help build an immune system. If everyone they see is keeping distance and wearing masks, could this have long-term impacts on a child's health?
That's a great question.
He means exposure, right?
Yeah. So that's a great question, and the real answer is, in the short term, we don't really know. So kids are designed to get sick, and we know that keeping their lives too clean is not good for them either. But this year's circumstances are different, and so we have to, the downside of of keeping kids home because of COVID and all the social distancing is that kids are going to or it's either a downside or an upside, depending on how you look at it, is kids are going to get sick less with all the other things that they get sick with. So that's a great question that there's not an easy answer to. I think that's something that our scientists will look at in the future and say, well, what does this mean going forward?
Right. Maureen wants to know your opinion on having kids eat lunch in a classroom with their cohort instead of in a cafeteria. Thoughts on that?
Yeah, I think it's really all about like everything else, the devil is in the details. So I think the challenge is if they're eating in their classroom and their masks are off, that may or may not be the best thing. I think the cafeteria is probably a tough environment as well, just because of all the movement and the activity. If it's up to me, I think the ideal for eating lunch would be, if weather permitting, have kids do it outside. You take advantage of the outdoor spaces that most schools have, and do it outside. Um, I think again, it's all about the details and how the classrooms are spaced out and what the distancing is like. Um, the distancing that might work when everybody's wearing a mask might not work as well when everybody has to take off their mask to eat lunch.
Gotcha. Okay. Massachusetts students are required this year to have a flu shot as they go into school. How important is this mandate? And from a doctor's perspective, how important is it from a public health standpoint?
Yeah, I think it's important for us as physicians, and it's really important from a public health standpoint. I think um, the combination of COVID and then adding on the a normal flu season would be really difficult for our health system. As it is, on many flu seasons, our hospitals are at or above capacity. So you add flu plus COVID, that could really be a big stress on our health system. And likewise for our physicians' offices. The challenge with COVID is that it's very hard to distinguish COVID symptoms from flu symptoms. So whatever we can do to minimize the amount of flu that's circulating in the community is good for everybody.
Okay. Correct me if I'm wrong, but flu, unlike COVID, does seem to impact children.
Mhm.
It's a scary diagnosis to get, right?
Sure. Yes, flu every year causes up to several, can cause a lot of deaths in kids each year in this country. Kids can get very, very sick with flu. Not to say they can't get very, very sick with COVID, but flu tends to affect kids more. Uh, I don't want to say disproportionately, because the elderly get also affected a lot by flu as well. But COVID also is affecting middle-aged adults quite a bit more than it affects kids, and flu is very different in that regard.
Mhm. I know you're not an infectious disease doctor, but in your experience, in your knowledge, if you will, can you walk us through what might be some of the key differentials between maybe knowing if it's flu or COVID? Are there key different symptoms or not?
There can be, but they also overlap. They can overlap substantially. So it's very hard clinically to distinguish between the two. There is, most offices have testing for flu, although the flu tests aren't fabulous. There are a lot of what we call false negative tests, and so it's hard. But it's very difficult to distinguish between the two.
Maureen wanted to know, should she get her child tested for COVID-19 every time they have some type of symptoms?
So it really depends what the child's symptoms are, especially if there's more than one thing going on, like a fever plus a cough or fever plus a runny nose. It would be good for them to be tested. It's important for the family to know, so the family can act appropriately, and it's also obviously very important for their school to know if there's COVID in the school, so that contact tracing can occur and extra monitoring can happen. So I think if your kids are sick, if they have, especially if they have more than one symptom, or if they have one symptom that's particularly severe, like a very high fever or severe cough, you'd probably want them to get them tested for COVID.
Okay. Barbara has written in and she wants to know, there's talk about a second or even a third wave of this COVID-19 surge, if you will. What are the odds, or what are you hearing about something like this?
That's a really, really tough question, and I'm not sure I'm the best person to answer it. Um, I think one of the differences between now and the first surge that we had, in the early spring, is that we do have a lot more testing versus, in February and March and early April, testing was a problem. And for example, in April, we had very limited ability to test kids. Now our ability to test kids is much more. So I would hope that because we can test more, at least we'll have a better sense of what's out there. That's maybe being over optimistic, but it's hard to say. I think it just depends. It really depends on so many things. Like, for example, how well we do with the distancing and the masking. What was the effect of the last holiday weekend, and did people spend too much time with other people not wearing masks? It's really a lot of questions. There's still lots of questions.
Okay. Who, as far as children go, who, what types of children are at risk for developing COVID-19?
Sure. So we think it's kids who have pre-existing health issues, especially kids who have complicated health issues, kids who might have like a tracheostomy or have severe neurologic compromise so that they have problems with their respiratory system. That seems to be the group of kids who seem to be at highest risk based on what we've seen in the literature. Those type of kids who have other chronic medical problems where they're otherwise severely compromised.
Okay. Barbara, actually, I'm just was looking at my questions here. Some people have asked about the effectiveness of the flu shot this year. Are you hearing anything about that, or is it still too early to know?
Yeah, it's really too early to know. You don't really know how effective it is until the season has had a chance to progress. So given that we're really just starting to give flu shots, and there hasn't been very much flu circulating yet. It's really hard to know. We don't really know until much later in the season.
Okay. All right. We talked earlier about role playing and getting your kids prepared for what the school year will look like. Social interaction is such a huge deal for kids. It doesn't matter whether they're in kindergarten or they're in high school. What are some things that parents can do in order to prepare kids for the fact that they may not see their friends as often during the week, and how can they instill or at least put together social interaction outside of the classroom?
Sure. That's really hard. And that's been obviously one of the hardest parts about this whole epidemic is just the ability that the amount of time kids have been able to spend with their peers has been really diminished. So I think you just have to build in opportunities where they can still do things. I think, for example, in the fall, especially while the weather's nice, take advantage of being outside. I think outside is the best. You can do lots of things outside, even keeping at a distance. There's lots of things kids can do outdoors that are safe and it still allows them to see their friends. It's not going to be as intimate as it would be normally, but it's still better than not doing anything at all. As we get into the colder weather months and the outdoor activities become a lot more limited, this is a place where, using some of our technology and our social media is probably okay. And we always are trying to get kids off their screens and trying to do more things, but doing video chats or coming up ways to play interactive games. And there are all these different platforms where you can do almost like board games or card games, but doing it on a computer or on your tablet. That's at least somewhat interactive. And if they're doing it with like a Zoom going on in the background or something like that, it's social. It's not in person, but it's better than nothing. So those are types of things. And also the other things is, there are plenty of sports that are starting to go on and, being done with the right social distancing and the masking. And that's a great way for kids to interact with each other.
Should parents anticipate, especially in younger children, any type of behavioral changes that they should keep an eye out for?
I don't think they necessarily have to anticipate it, but I think what we're seeing is that kids who have some challenges in any case, like with problems with anxiety or depression, seem to be having a harder time with all the various COVID restrictions. Different kids have different amounts of resilience, and so I think you just have to be on the lookout that if your child's not acting like himself or herself, think about why, and if you need help, give your pediatrician a call. All of us have access to behavioral health folks that we can help out with, that can help our patients out. But that's really important. If your kid's having a hard time, give us a call.
I think this is a nice segue to Allison. She has written in her question, your thoughts on the mental state of children at this time. It can be a little disconcerting for them to see people constantly in masks or feeling a little unsafe or being kept apart from those that they normally would see on a regular basis. What are your thoughts on that?
I think like everyone else, a lot of kids are having a real hard time with this. And to say that they're not and to not acknowledge that, it would be, not incorrect. So I think we have to acknowledge that a lot of kids are under a lot of stress, and sometimes that's the case because their worlds are turned upside down in terms of what's maybe going on in their family, or what, if a parent has lost a job, or if they're having other types of problems. So, there are lots of kids who are having a lot of challenges with this.
Okay. Any tips on teaching your kids about safe practices? Do you have any tips that you would share with your patients?
Well, I think you have to talk about it. You have to, as a parent, you have to, you know, walk the walk, if you know what I mean. You have to basically, you have to demonstrate the right way to do things, and you have to talk about it. You have to talk about what schools could be like. You have to let them know, that we've talked about it, and we're going to do everything we can to keep you safe. Um, and practice, practice the things that they're going to need to do at school. They need to practice it at home.
And how important is it for you say we have to practice it at home as parents, but how important is it for parents to also take care of themselves and check their mental health during this time as well? It's very
Yeah, you
stressful
know,
for a lot of parents, right?
absolutely, and I think that's essential because your kids, when you're stressed, your kids know it. Their kids are of all ages, even infants and toddlers. They know it when their parents are stressed. So we as adults have to do what we can to take care of ourselves. Getting enough sleep, trying to get exercise, eating well, uh, getting outdoors, trying to get off our devices and our screens. You know, shutting down our work lives. If that's sometimes the work from home stuff can sometimes for some people can be worse because then the boundaries that we used to have when we were physically in the office aren't there anymore. So doing all those things to take care of ourselves will help us take better care of our kids.
Sure. Everyone wants to go back to, the full old-fashioned normal. What factors do we need to have in place before that's even a good idea?
Well, we need to have some kind of herd immunity, and that either comes through vaccination or through more people being sick with COVID. And I think we don't want it. We don't want it to be the situation that almost, I think the number I've heard is that 70 or 80% of the population would have to get COVID for us to have that degree of herd immunity. And I don't think that's what we really want. So it's really about, if that's the case, if that's not the option, then it's having a vaccine that's safe and effective, and however long that takes to happen.
Mhm. Okay. Switching gears just a little bit, still talking about kids, but let's talk about babies for a minute. Newborn babies and new parents who are coming home with a newborn baby. What are some tips you can give them? It's a scary time for them too.
Yeah, sure. I mean, I think one of the things that we've been very thankful about is that we've had there's been plenty of experience of babies born to parents with COVID, and in general, those kids have done really, really well. So that's been, I think, a thankful thing. That's something that we've been very worried about. But the experience has been good. I think the challenge, of course, when you have a new baby is that especially if it's your first baby in the family, everybody wants to see this baby, everybody wants to touch this baby. And that's obviously not the thing that people should do. I think you have to just be really mindful about keeping yourself well, and keeping distance and limiting visitors. And that's a sad, having a new baby is a wonderful thing, and that's kind of sad that you can't share your baby with the world. That's not the thing to do.
Any parting words tonight? Some advice that you would like to give parents and kids as they get ready to start next week? Things to keep in mind.
Yeah, I think this is so challenging this time, but trying to keep positive about it, and making the best of the situation. You know, we will get past it at some point, and we'll look back at it and we'll look and see, how did we do? And I think if we look at it and we say, yeah, we did, this was really hard, but we did our best, and we think we did a good job as doctors and as parents and as teachers and all that, then we can hold our heads high. So I think it's really about trying to keep this as positive as we can be, despite what's a really challenging situation.
Great words of advice. Dr. Warhaftig, I want to say thank you so much for joining us tonight. It was really a pleasure, and you actually eased some of my fears as a parent, so I thank you for that.
Pleasure.
I want to thank all our viewers at home who sent in their questions this evening. If you didn't catch this whole Facebook Live segment, you can catch it on WCBB's Facebook page, as well as onehealthyboston.com. We want to thank everyone, and we also want to thank WCBB for letting us have this opportunity to bring this great content to you. Have a great night, everyone, and we will catch you here again next month.